I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I would like to spend a few minutes talking to you about the very popular office-based injectable treatment known as Botox. Botox is a revolutionary cosmetic procedure that has been done billions of times around the world in the past 10 years. It is a very highly successful procedure, oftentimes better than what surgery can do, but yet there are a lot of misconceptions in the general public about what Botox is and what Botox can do. And I'd like to help clarify that for you in the next few minutes. Botox is made by one and only one manufacturer. And so therefore there are no substitutes to Botox, there are no alternatives. There is one and only one, and that is the Botox from the Allergan company. This is the one that is used around the world. Perhaps there will be some competitive analogs in the next few years, but right now Botox is the one drug that is available for cosmetic treatments. Botox is a paralyzing drug. It essentially paralyzes the muscle by getting between the nerve and the muscle to make it work. Therefore, what it does do is it stops undesired expressions, most commonly in the forehead and around the eyes, and that probably accounts for where 90% of all Botox is used. It is a simple, office-based treatment that takes but a few minutes to do, that has only very minimal amount of discomfort. One of the important things about Botox is that it does not work immediately. And that is confusing to a lot of patients. Just because you get a treatment today doesn't mean that it is going to work by tomorrow. It generally takes about a week to see the full effects, and I never try to supplement or touch up any Botox results till at least 2 weeks after the initial treatment to be sure that we are looking at the maximal effectiveness that it is going to do. Also, Botox is really for the treatment of what I call dynamic wrinkles. Those wrinkles and lines that occur because you make that facial expression. It will not treat what is known as static wrinkles. Wrinkles are lines or folds that exist when you are simply sitting there without making any expression at all. That is what injectable fillers are for, to treat static lines and wrinkles. Botox is used for the treatment of dynamic lines and wrinkles. Sometimes they may be used together. This is particularly true in the 11, where there's vertical lines that occur between your brows, as it is commonly known. So it can be done as a combination, but Botox is for dynamic wrinkling, injectable fillers is for static wrinkling, and just because they all come out of a 30-gauge needle doesn't mean that they all do exactly the same thing. Botox, while a great treatment, unfortunately is not permanent. The average duration of time one can expect to see the results is going to be anywhere from 4 to 6 months. Probably 6 months is the longest duration of action. 4 months is a good time. Most people may not be too perceptive in the last month or two as to that fact that its effects may be fading away. So that is what you can expect. To the best of our knowledge today, you can do Botox an endless number of times. One does not appear to build up a tolerance to it. One does not get immune to it. It seems to wear off, and you repeat the same dose and you'll get the same effect over and over and over again. So that is its one great disadvantage, is that it is not permanent. There are some competitive analogs out there to Botox, which, as I mentioned earlier, may be coming onto the market in the next year or two, but there's no evidence that any of them are going to last longer than Botox. Well, I hope this information about Botox is helpful. This is what I tell every new patient that I see. Botox is simple and easy to understand, and I hope that this has been very helpful for you. I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I wish you luck in your cosmetic experiences.